Hello, this is Dr. Mary Manis. I'd like to speak today about empathy as a clinical skill. Presentation objectives: to define empathy in the context of patient care, and to review research findings on empathy in medical practice, training, and education. Empathy in medicine is obviously not a new concept. To quote Hippocrates, cure sometimes, treat often, comfort always. Osteopathic philosophy embraces empathy with its emphasis on the connection between body, mind, and spirit in maintaining health and in self-healing. So you've all heard and used the term empathy. It actually has a specific meaning in patient care. It's primarily a cognitive and not emotional attribute, according to Hojat in his article published in 2018. And it makes a lot of sense when you look at it this way. It requires an understanding of the patient's pain and suffering. It does not require feeling the patient's pain and suffering. It's not affective empathy. It does not require similar personal experience. It's not sympathy. And it does not remove objectivity and the focus of care from the patient. Cognitive empathy is also a skill. It requires communicating this understanding, and it requires communicating this intention to help. Like other skills, it can be improved with knowledge and practice. So what are the benefits to patients of physician empathy? Higher physician empathy scores correlated with better measures of patient clinical status and satisfaction. These studies are included in the references at the end of the presentation, where higher numbers of patients with diabetes had optimal blood sugar and cholesterol levels. Patients had lower hospitalization rates for acute metabolic complications from diabetes. And patients gave higher ratings of their communication experiences with their physicians. There are also benefits to physicians of cognitive empathy. It can provide physicians with a framework in which difficult emotions can be acknowledged and processed. It can encourage mindfulness that helps keep detachment therapeutic instead of depersonalizing. And it can contribute to physician satisfaction by helping to clarify role and responsibility in medical practice. There are also benefits of cognitive empathy to student doctors. Higher medical student empathy scores correlated with better measures of clinical competence and communication. Read assessment, read grade. Observations of empathetic communication pattern with standardized patients. Standardized patient ratings and objective structured clinical examination, or OSCE stations. And faculty ratings and core clerkships in family medicine, internal medicine, obstetrics and gynecology, pediatrics, psychiatry, and surgery. These references are also available at the end of the presentation. Empathy in medical students, as measured by Jefferson Empathy Scale, showed that students with higher empathy scores had higher levels of agreement when asked whether they thought improved patient outcomes are associated with physicians understanding the patient perspective, ability to decipher nonverbal cues and body language in communicating and emotions in patient-clinician relationships, belief that empathy is a therapeutic factor, and belief that a patient's sense of humor is associated with clinical outcome. Interesting findings. These in part prompted the American Association of Colleges of Osteopathic Medicine's Project in Osteopathic Medical Education and Empathy. This project started in 2017 with a cross-sectional study of first through fourth year students that produced a national norm table of empathy scores in osteopathic medical students. They were administered the Jefferson Scale of Empathy. There were 6,009 first-year osteopathic medical students, representing 93% of all U.S. College of Osteopathic Medicine campuses. Now, currently, Phase 2 is administering the same scale to fourth-year osteopathic medical students. Those studies will come out, right about as you're graduating maybe, but if they come out before then, we will be sending those results out because They're very important. We need to see if osteopathic medical students in today's world, the studies yield the same results as those previously discussed in this presentation. Improving empathy as a skill initially is gaining knowledge about the role of empathy in patient care and relating it to professionalism and medical ethics. Practicing taking or viewing the patient's perspective in clinical scenarios or role-playing. And practicing deciphering nonverbal cues and body language and communicating in role-playing or with standardized patients. Obviously, these are all things we'll be doing in clinical medicine this year as well as next year. So, improving empathy as a skill in follow-up. Gaining knowledge about the role of neurobiology and physiology of emotion and empathy, and relating it to nonverbal communication and empathetic management of challenging patient behavior and self-regulation in challenging circumstances. This is ongoing throughout your 3rd and 4th years, as well as residency and the rest of your career. Practicing self-regulation in role-playing or with standardized patients is how you can prepare for that, as well as practicing deciphering nonverbal cues and body language in communicating with the difficult patient or challenging circumstances during role-playing or with standardized patients that we'll be including in clinical medicine too. So, empathy is based in neuroscience of emotion, communication, and behavior. It can be viewed as a clinical skill. It could be explained with knowledge, understood with observation, and improved with practice. And it can affect outcomes for patients, physicians, and medical students. Thank you for your attention.